Welcome to Pharm Geraldinho TV. Have you ever sat in a hospital, clinic, or pharmacy and felt completely lost when healthcare professionals started talking? Words like hypertension, antibiotics, intravenous, acute, chronic, diagnosis, prognosis, and suddenly it feels like you're listening to a foreign language. You're not alone. In fact, medicine really is a language of its own. And the good news is this: once you understand the basics, medical terminology stop being scary and start making sense. Today, I'm going to break this down in a very simple, conversational way, no cramming, no confusion. Whether you're a student, a healthcare worker, or just someone who wants to understand what doctors, pharmacists, nurses, and lab scientists are saying, this lesson is for you. Let's start with something very important. Medical terminologies are not random words. They are structured, logical, and predictable. Medicine is built on precision, so its language follows rules. Most medical terms are formed from three main parts: the root word, a prefix, and a suffix. Think of medical terms like building blocks. Once you understand how the blocks fit together, you stop memorizing blindly and start understanding. With this knowledge alone, you can interpret hundreds, sometimes thousands, of medical terms you've never seen before. Now let's break that down clearly. The root word is the core of the term. It usually tells you which part of the body, organ, or system is involved. For example, cardi refers to the heart. Neph refers to the kidney. Hepat refers to the liver. Pulmon refers to the lungs. Neuro refers to nerves. Gastro refers to the stomach. Derm refers to the skin. Hemat refers to blood. So anytime you hear a word with neuro, like neurology or neuropathy, you already know the discussion is about the nervous system. This is why healthcare professionals seem fast. It's not speed, it's shared understanding. Next comes the prefix. The prefix appears at the beginning of the word and gives extra information about amount, position, time, direction, speed, or condition. Some common prefixes include hyper, meaning high or excessive. Hypo, meaning low or below normal. Brady, meaning slow. Tachy, meaning fast. Poly, meaning many. Oligo, meaning few. Pre, meaning before. Post, meaning after. Sub, meaning under. Inter, meaning between. So when you hear hypoglycemia, break it down. Hypo, low. GLYC, sugar. Emia, in the blood. That's low blood sugar. Simple. Logical. Now let's look at suffixes. Suffixes usually come at the end of medical terms and describe what is happening, whether it's inflammation, disease, condition, procedure, or process. Common suffixes include itis, meaning inflammation. Osis, meaning abnormal condition. Oma, meaning tumor or swelling. Ectomy, meaning surgical removal. Plasty, meaning surgical repair. Ology, meaning study of. Pathy, meaning disease. Emia, meaning something in the blood. Urea, meaning something in the urine. So when you hear hematuria, you don't panic. Hemat, blood. Urea, urine. That means blood in the urine. This is the same language doctors, pharmacists, nurses, and lab scientists all understand. Now let's move into everyday medical terms patients encounter constantly. One very common pair is acute and chronic. When a condition is described as acute, it means it starts suddenly and usually lasts for a short time. Acute pain. Acute infection. Acute malaria. Chronic, on the other hand, refers to conditions that last a long time, months, years, or even a lifetime. Chronic hypertension. Chronic asthma. Chronic kidney disease. Acute is short-term and sudden. Chronic is long-term and persistent. Another word patients hear often is diagnosis. Diagnosis simply means identifying a disease based on symptoms, examination, and investigations. Then there's prognosis, which many people confuse with diagnosis. Prognosis refers to the expected outcome, how the disease will progress and how likely treatment is to succeed. So diagnosis answers, what is wrong? Prognosis answers, what is likely to happen? Now let's talk about pharmacy-related terminologies, because prescriptions are one of the most misunderstood parts of healthcare. When a drug is taken orally, it's taken by mouth. Intravenous, IV, means directly into the vein. Intramuscular, IM, means into the muscle. Subcutaneous means under the skin. Topical means applied on the skin. Rectal means administered through the rectum. Sublingual means placed under the tongue. These routes are chosen based on how fast the drug needs to work, how well it's absorbed, and the patient's condition. Another important pharmacy term is dosage. Dosage refers to the amount of drug to be taken at a particular time. Frequency tells you how often, once daily, twice daily, every 8 hours. Duration tells you how long the drug should be used. When pharmacists insist on completing antibiotics, it's not stubbornness, it's pharmacology. Now let's address nursing terminologies, because nurses are the backbone of patient care. You'll hear terms like vital signs, temperature, pulse, respiration, blood pressure. For fluids, fluids administered through the vein. Intake and output, monitoring what goes into and out of the body. Catheterization, insertion of a tube to drain urine. Wound dressing, cleaning and covering wounds to promote healing. When a nurse says a patient is stable, it means vital signs are within acceptable limits. When a patient is critical, it means close monitoring is needed. Now let's touch medical laboratory science terminologies, because lab results guide diagnosis and treatment. When doctors request tests, they may ask for CBC, complete blood count, checks red cells, white cells, and platelets. ESR, measures inflammation. Blood culture, checks for bacteria in the blood. Urinalysis, examines urine for infection or disease. LFT, liver function test, checks liver health. RFT, renal function test, checks kidney function. Fasting blood sugar, checks glucose metabolism. When a lab report says normal range, it doesn't mean perfect, it means statistically acceptable for most people. Let's now talk about clinical terms patients often misunderstand. A symptom is what the patient feels: pain, nausea, dizziness, fatigue. A sign is what can be observed or measured: fever, swelling, rash, high blood pressure. Contraindication means a drug should not be used because it may cause harm. Indication means the reason a drug is prescribed. A side effect may be mild and expected. An adverse effect is harmful and requires attention. Antibiotics treat bacterial infections, not viral ones. This single misunderstanding is responsible for massive drug resistance worldwide. Drug resistance occurs when bacteria learn how to survive drugs meant to kill them, often due to misuse. Now erase the powerful truth. Once you understand medical terminologies, you don't just become informed, you become empowered. You communicate better with healthcare professionals. You understand prescriptions and test results. You avoid misinformation and dangerous self-medication. You make smarter health decisions. This knowledge is not for doctors alone. It's for patients, caregivers, students, and everyday people. And as a pharmacist, I can confidently say this: an informed patient is a safer patient. Now erase the challenge, and I really want you to think before you answer. If medical terms are built logically using prefixes, roots, and suffixes, why do you think many people still feel intimidated by hospitals and healthcare workers? Is it the language itself, or how it's communicated? Drop your thoughts in the comments. Not just a word, give me your reasoning. I'll be reading and responding. If you found this breakdown useful, Please like this video. Share it with anyone who values clear and reliable health information. Subscribe to Pharm Geraldinho TV for trusted medical education made simple.